So thank you everybody for being here today. I want to give all the time that we have to Dr. Richards. And I think we have several questions we have already gotten from students that they want to hear you address.
All right, fine. We can start with that versus anything else.
Okay.
Yeah, I've been a nurse a long time.
So you're the holder of the questions. Do you want to go ahead with the first one?
Sure.
We're going to pause for a minute, too, when we get a microphone over here so that it's easier for Dr. Richards to speak without
and actually, you have, the TV thing is there now because I tend to walk around a little bit,
Okay, well, let's move this then until you want it. So
all right, fine,
All right. Our first question from our students is, during your time as Dean at Ohio University, what were some challenges that you faced, and how did you work to overcome those challenges?
Well, I came to Ohio University at a really great time in the university's history, and Dr. Charles Ping was the president, and it was just a great time. And I came from New York City. I had lived in New York City 23 years, got all my degrees in New York City, and so I was leaving the city. I want to tell you, people have asked me this for many, many years. My biggest challenge was learning to drive. I hate to say, and I had some others, and I'll talk about those, but it was learning to drive. I was 43 years old. I had lived in New York City 23 years, and lots of New Yorkers don't drive. And so I got 2.5 hours of driving lessons before I came, which meant I could turn it on and off and whatever. And my boyfriend of the time and I drove, and he wanted me to drive sometimes, and he said, when I drove, it helped him keep awake. I was not good, right? So anyway, that was my really biggest challenge. But I came, and the provost of the day, Neil Bucklew, said, yes, you have this job description. It's a nice job description. They typed it out nicely. Now put it in your drawer, and now go help create the college. And that was the real challenge, and it was a fun challenge. Now, I had been in New York City in very trying times, and so I knew how to live frugally, in administration, and how to sort of build things out of nothing. And in fact, he says, go create some programs with no money. That was a sort of a challenge. All right, and so the first thing, and of course, I knew nothing about sports, was not interested in sports, and I had all these sports things in my college, right? So I do talk a lot, but there are times I did learn to keep my mouth shut when they were talking about whatever it was, soccer or this or that, the other. Over the years, though, I was here 7 years, and nursing came a little later to the college, a year later, and it was in education, because all these programs were here, but they were in different places. And hearing and speech sciences, which is another name I know, was in arts and science, and that came. So there were just lots of, and really to start getting these people to cooperate, and the school directors to cooperate, and to be cordial. So we had weekly meetings, we did things together, we had activities together to try to get both the school directors, and then if that works well, it goes down then to the faculty, and to get the faculty to work well together. A challenge, all right? Another challenge was to create, we had nursing, and we only had, we had the RN completion program. There were RN completion program on all these campuses, and I went out to so many of the campuses and went to the lectures there to these fantastic faculty. But a program that was a real big challenge to create was physical therapy. And I created it in a day when the Physical Therapy Association wanted a doctoral program to be the first degree, and the chancellor of the university system said, no, you can't do that because we don't think that's right. All right, this nice man. All right, so but we did after much ado, and really getting money from different ways within the university. We finally pulled slowly together some program, enough money to get a person, and I worked with a person who was the director of the school. I'm writing down what she says to write down to get this proposal together, because in contrast to nursing, in physical therapy, your program has to be approved before you can start your first class. In nursing, when you start, because I've started nursing programs before, you get it approved at the point when you're graduating your first class. So it was a very different kind of, and it was a challenge. What did I know about physical therapy? I learned. I just learned about all these different really wonderful things, and there were a lot of, I'm going to tell you one little challenge. All right, I had physical education in the college, and we had women and men faculty, and the physical education faculty, I don't know what they're like. They were, try to be like, they like to be macho, right? And the women faculty in physical education were really annoyed with the men. And at one point, we had a faculty meeting, whatever place, and I'm trying to, I'm good with interpersonal, trying to get people to talk and be together. And the men decided, well, some of the men had some posters in their offices that were not real kosher. They really shouldn't have been there, right? All right. So whatever, Cheryl Teague or whatever with nothing on, and whatever, a few other, in different offices, it was in their offices, and the men said, the reason why the women don't like it is because they're gay. That was not a very nice thing. All right, so I said, we had to massage that a little bit. So the women said they really resented all these faculty retired and gone, so you don't know them. All right, so they resented these posters. And I said, geez, I can understand that. And I said, well, maybe, men, why don't you just take the posters down? Well, you think they would take it down because I said so? No. So one day, I walked over to the building and I started through the offices. And wouldn't you know, the first one I opened, they had a real big key with not much on. And then there were a couple other offices like that. And I said to whatever his name was, let's call it Bill, I don't know what his name was now. Bill, you really ought to take that down. He said, my daughters gave me that. I said, oh, that's great. Why don't you take it home and put it in your family room? Well, that's, my family room is full. I said, look, I want to tell you something. I'm going to walk down this hall, and by the time I come back, I want that poster off the wall. Well, he turned red and a few other colors. And so I walked down the hall. They called one another, thank God. By the time I got to the associate directors, he had taken his down, right, from behind the door. And I walked down, I'm smiling and gracious, etc. And so by the time I walked, and in fact, I had to say to some, now, if they put up Burt Reynolds, you probably don't know Burt Reynolds, but Burt Reynolds, he was in Playgirl in the nude, you might get a little resentful. They said, oh, we never thought of that, huh? All right, so I got back down the hall. I walked a little better then, and went in there, and the poster was down. I want to tell you, that made my name on campus. I was shocked. Before I left the building, it was over on campus. By that day and the next day, even men, nice men called me and said, we heard what you did. Well, it made it easier to get money through these committees. I couldn't believe, the kind of, because it's the male-female thing, and how impressed people were with that little thing. And it obviously, to a lot of people, it was a very big thing, and especially to the ones that had to take their little posters down. But anyway, that was one little challenge.
Another question is, what is the most significant change in nursing care that you've seen over your years with experience and knowledge?
Now I want to tell you, the world has changed since I graduated from nursing school. And so I have friends now who will say, oh, I have some kind of rare thing. I say, no. I may be a good listener, and my punchline is, oh, that really sounds serious. Why don't you call the doctor? The world has changed. I graduated from diploma school nursing in Missouri in 1956, before all of you were born. All right? Because we've had little anniversaries and stuff. All right. And at that point, and I use this, it's just about the way it was. The only people that had heart attacks, according to the doctors, were white men. White women didn't, black people didn't, nobody had a heart, except white men, because they didn't know how to diagnose it, see? All right, and they would, even for the white men, they'd say, you've got this heart, you need to go home and get in the rocking chair, don't move too much. That was it. So I have gone full circle through the changes in healthcare. And there was really no insurance then. The rich people had insurance, the poor people went to emergency room. All right, so in the middle class, you paid for their insurance or for their care. And so I have a bachelor's and 2 masters and a doctorate. So even over those years, nursing and healthcare has changed so drastically, and basically in a good way. There are not a lot of things that are not all so good, but really in a very good way. So I have seen, you know, open heart surgery, all kinds of things, new hearts. I have a friend who just had his anniversary having had a new heart, and I have another very good friend in her 50s had to get a new heart. Had another friend that got new lungs. You know, all the kinds of things that are just almost routine, quote unquote, now as compared to a few years ago. So most of you are really young. All of you, you're baccalaureate complete. You're BSN students, most of you, right? So you are coming to like a new world as compared to what I was in, and in fact, there have been a number of new worlds since then. Of course, many nursing graduates go into nurse practitioner programs, which I think are fantastic, are great, to get that kind of specialty and really be able to do the kinds of activities and things that they can do. That wasn't there when I was there at the beginning. So I have seen nursing grow and develop into a really good profession. Actually, when I started in nursing as a student, now I didn't do it because I was not always considered cooperative. That was the term they used. When the doctor went into office, the nursing station, you were supposed to stand up. The doctor called you by your first name, you called him by his last name. All right. Well, you won't do that. I mean, it's just, a world has changed. And I remember reporting on a doctor, a resident who in psychiatry, because that was my specialty, who wasn't really seeing the patients, and I went and told the head doctor, because that was the way I was, and he talked to that doctor, and that doctor was so PO'd, and he said, from my country, he was from Europe someplace, you would have to stand up, and you know, and he wanted 2 or 3 drawers in the nursing station, because you know, he was a little aggravated that I had done this to him, because he was recording, he was seeing these patients, and he was not. All right, so I was always in all my positions considered a little uncooperative, and I knew early on that I had to get a doctorate because I had to be the boss, because my mouth was so big. All right, and the only way to keep a job and do things was to, you know, at least be able to advance and be the quasi-boss. Think about that for yourselves. Not because you're bossy, like I am, but because for advancement, you really need much advanced education. And I know you're saying, God damn, I'm struggling here. You know, get through this thing.